podcast has stories of real-life events and true crime that happens every day. These stories may contain adult language and graphic or disturbing details not suitable for everyone. Listener discretion is advised.
132 in Bush, I've got him at gunpoint.
They're pulling them out.
911, advise ready for gameplay.
Welcome to another episode of War Stories. I am Tom.
And I'm Chuck.
And I've decided to switch it up a little bit. Remember, I was asking if I should just change it and stop doing that. And I decided if we're going to keep it for consistency's sake, I'm just going to change up how I say it. And I'm Tom. To just do something to spice it up. I don't know. But how are you? Yeah. You're back. Wait, let's see. I think we're into March now. Even though we're recording this in February.
It was yesterday we were in March. Yeah.
We're
other one. Cool. Uh-oh. Is everybody else frozen? No, just him? Sorry, folks, we're having some technical difficulties in a minute and a half in. Well, this is a War Stories episode, and Tom, our fearless leader over here, is having some technical difficulties with his Wi-Fi, his Wi-Fi, not his wife. But here he's back.
Yes.
I thought it was me. I was like, uh-oh.
No, it's not. I just have to get my camera working.
Are you having Wi-Fi issues?
No, dude. This is some nonsense that I was telling you about with all my everything on my USB equipment just decided to stop all at once and say.
I had to switch to a USB-C one because I have the other one to just run lights, and this one runs all the keyboards and the cameras and stuff. I had to go to get a fucking new one that cost me $60, and it's big. And it's only got 4 ports on it.
Let's hope this holds up. So if I disappear, keep talking. I'll get back in it.
Yeah, we'll do.
So, but this week we want to get right to our guest. So last week was last week was a rough one. But it was a good one, and we appreciate Destin for coming on. God bless him. And we're here for you, brother. We should have him back.
Yeah, definitely. I think we should take a moment, though, and just recognize the fact that, we need to have our brothers' backs out there, regardless if they go out or not. And if we're still working and your buddy goes out and you turn your back on him, are you going to be able to sleep if something happens? I don't think so. But I think that the culture needs to start shifting, and you really need to start, not everybody is the same. Not everybody, handles things the same way. They might handle something different than you do. We're all different. We're all humans. So I think understanding that and just being a little bit more empathetic towards our partners is really important. So the guy we just had on, great guest, awesome dude. He's struggling with some stuff. And I know so many others with the same story who are struggling. And a lot of them get their backs turned on them, and it's not right. And I think we need to start shifting that culture and really having our brothers and sisters' backs out there.
100%.
Yeah.
So for this one, I think our next guest, because a lot of that has to do with what we talked about on last week, which is the culture of the department and the agency, right?
Yeah.
And I think
this week, because I think this week's guest, I've been teasing her appearance because I've been looking forward to it. This is a friend of mine. At least I'd like to call her a friend. She might jump on here and disagree real quick, but.
Cool. So we have Tom's friend who's in. She is a flight surgeon, if I'm not mistaken. Her name is Jessica. We're just going to bring Jessica onto the stage. Hi, Jessica. How are you?
Hi, good. Long-time listener, first-time caller. So happy to be here.
Awesome. So while Tom's not here, give me the scoop.
Let's
on
talk
him.
about
so,
him. Yeah.
You're his doctor, right? And you also met him doing some stage performance stuff.
Yes. Yeah. I first met him doing Bye Bye Birdie. Yeah. And if he's willing to tell you that I'm his doctor, then I'm willing to tell you that I'm his doctor.
I think he mentioned it. Yeah. If not,
yeah.
HIPAA, I'm fucked. And
Yeah, you.
strike that from the record.
Exactly. Can
Not
you cut this
doctor,
part? Thanks. Not doctor. Yes,
doctor
yes.
friend.
Yeah. There we go. Fair enough.
There
Yeah.
we go.
Yeah.
All right. So this is Jessica, Tom's doctor friend. She's also a flight medic, or a flight surgeon. I'm sorry. He's talked about you
Yeah.
so much that I'd be remiss if I got it wrong. Flight doctor,
It's like
flight surgeon.
surgeon.
I fucked
You
that
got
up
it.
so
Yep.
many times. I'm so sorry.
My doctor
So
friend,
yeah.
flight surgeon.
Yeah.
Yeah, we got that far.
Oh, geez,
Welcome
dude,
back.
I had to raw dog this. My whole studio, the angles are all messed up. Just bear with me, folks. This is insane. I don't know what's happening. It is my good friend, Dr. Jessica Jameson. Yes, and I heard all the trash you were talking. I love all of it. That's you love me. So we have done shows together, yeah. And you are known for singing to people when you
Yeah,
treat
oh,
them. And yes, I'm okay with the world knowing that you are in fact one of my doctors that has treated me. I figured if she could operate on people in the sky in an airplane, my back was safe on the ground with her. Little did I know that when we sang together on stage way before, I didn't even know you were a doctor.
Yeah.
And one of our co-stars in the
Oh,
show.
wow.
So what does Jessica do? And she's a doctor. I'm like, oh God, I'm acting. I'm on. Oh no. I was like immediately intimidated, like legit, like, oh God, this woman's like a super professional, and here I am like a dumbass. So that was
Yeah.
and then it was
The
fun.
dumbass part is still accurate, but the super professional probably not.
No. So
you guys met doing plays.
Yeah.
Yeah.
Yeah. And
Yeah.
then she told me that she was an Air Force flight surgeon. I said, oh, we have to chat about that.
What hasn't it been like the last year we've been trying to figure it out or like how long has it been? Like
6
8
months.
9 months,
Probably
6
6
months.
months.
It's been a minute.
It's been a minute.
Yeah.
No, it's not your fault. Like we've been busy too. Like
It's all us.
But so let's talk about. I know this for your story. It's kind of short. We always start with how did you get into the service, right?
Mhm.
And so I kind of know it, but tell Chuck.
Yeah.
Oh,
Absolutely.
yeah. So, growing up, my grandfather was a West Point graduate, and his father was a
Nice.
colonel in the army. And so, when my grandfather retired, he was an engineer for GE, and when he retired, he became a recruiter for West Point.
Awesome.
So he lived in upstate New York, and so he was a recruiter, and his favorite thing to do is recruit soccer players. I just so happened to be a soccer player who, big surprise, got really good grades. School is fortunately not a super hard thing for me. So
Awesome.
my plan was to go to the United States Military Academy and play soccer. That did not happen. About I don't know, maybe like a month or two before, I changed my mind, decided I didn't want to go that route. I wanted to stay closer to home, whatever. If you ask my kids, they'll all tell you, they'll give you the list of my 3 biggest regrets in life. That's one of them. Although I don't even know if I can say that's a regret, right? Because I wouldn't be where I am now. Like if you think about
Right.
people that graduate from the academies like that, you've got to be really in the top small percentage if you want to go to medical school. So maybe I wouldn't have made it to medical school. Maybe all of this wouldn't have happened. Anyway, so fast forward and I get into medical school, and my grandfather then informs me that there's a way to have your medical school paid for and to serve your country. And I was like, sign me up. So that's when I entered the Air Force. I had the option to pick which branch, and my grandfather said, "You're going into the Air Force. It's the safest one." And at that point, I was like, "Sweet, I want to fly. That sounds great."
Nice.
Having no idea what it would really entail. So anyway, I went into the military as a medical student. So, and the way that works is that they pay for your medical school. You spend a couple weeks in the summer doing training with them, and then you
like
then
an
you pay
ROTC program.
Yep, exactly the same.
Yeah,
just
cool.
just medical schools. Yeah, so you owe them year for year. So
Mhm.
so that's how I got into it.
How many years do you owe?
Medical school is 4 years, so you
Mhm.
owe 4 years of payback time. There's there's different versions of it, and some will owe a little bit longer, some will owe a little bit less, but mine was a 4-year payback.
Okay.
Nice.
I know I'm stuck frozen. I can't figure out why, but we'll figure it out in a minute. I can still hear you. So, because my brother-in-law was looking to go that route, and it was going to be like 10 years so he ended up just going to dental school, but he was going to be a dentist in the Air Force at one point. And so I wasn't sure how it worked.
He was going to have to do his bachelor's and then his graduate, right? His postgraduate follow on, which would have led all.
I don't remember where he was in his education. He had to take a break in his education anyway for his church. He had to go away for 2 years. You can guess what faith they are. It doesn't matter. But so I was just curious how that works. So you did 4 years of medical school and then 5 years in the Air Force.
Yeah, right.
And at that time you operated on people in How do you learn to operate on people in an airplane?
No, I didn't operate on anyone. I operate now, but I didn't operate anyway. So so the way the military works is,
Yes.
so after you're done with medical school, you got to go to residency. So you can apply to do residency within the military, or you can do it outside of the military. But the needs of the military come first, as we're all aware. I ended up applying. I was going through rotations. I kind of liked everything. There wasn't anything that I really loved. Somebody said, "Oh, you should do family practice." So I said, all right. So I applied for a family practice residency within the Air Force. Then I got, so then I was stationed at Travis Air Force Base. I got about 3 months into that internship and was like, this is definitely not what I want to do. And so one of the beauties of the Air Force is they said, well, if you finish the internship, so in the United States, if you do a 1-year internship, you can then get a license. Now, this is 15 years ago. So now it's going to be really hard to get on any insurance contracts, but regardless, you can get a license to practice medicine. So I did my 1-year internship and they said, okay, now you're going to go to flight school. We're going to make you a flight surgeon. So the basic premise of flight surgery is that it was awesome. Don't get me wrong, but there's no real operating. It was the best years of my life, but you are assigned to a squadron, and wherever they go, you go, and it's mostly primary care for them. So I was assigned to 300 guys in an E3 AWACS squadron. Wherever they went, I went. So we were in Ecuador doing anti-drug cartel stuff. We were overseas. We were doing stuff in Germany and all these other places, and I just went with them, and I was in charge of determining all of their primary care stuff. So anyway, so that was what I did after that internship. So they then stationed me at Tinker in Oklahoma City. I went to flight school, survival school, and then back to serve my payback time, which all of that I did at Air Force. It is SEER school.
Okay.
It's not like that? Nobody punches you or beats you up. How was that? It was, they throw you out in the middle of wherever, the woods or something, and you've got to do all these different things. So in the spirit of full disclosure, I don't really love to camp in the woods. I don't really love any of that shit. So they basically put me with like 7 dudes out there, and they're like, good luck. So I was like, all right, which one of you assholes is an Eagle Scout? And the 2 guys raised their hands, and I'm like, all right, you're my guys. So I basically just hung out with those dudes. To this day, they're still good friends of mine. And we made it through. We made it to wherever we had to go. I bitched the whole time about like, why the hell do I do this? This is crazy. We never got captured. We didn't eat anything. I'm pretty sure.
That's what I was going to ask. I was going to ask if you ate rabbits or had to eat them or drink their blood or whatever.
Yeah, we had to like make a trap for a rabbit, and nothing ever came. And then one day we woke up and there was a white rabbit in the damn trap, and I was like, there are not white rabbits out here. I'm pretty sure somebody went to Petco and brought it back for us because they felt really bad for us. Anyway, we ate rabbit jerky. We rolled around the woods. And that was the extent of my survival training. That's what I had to do in order to fly in the aircraft. Oh, nice. A little bit less than pilots, where they're literally like beating the shit out of you in boxes and talking to you about, I know your mom kind of thing. Okay. But
why is that? Why is it different? Is it because they look at you as
you're medical
and
because the Geneva Conventions that we're the only ones that follow. Yeah, that. Yeah. So we're non-combatants. So they're in their mind, there will never be an issue where if your plane is shot down, they'll grab the pilot, but they're just gonna give you a warm bath and a cot. So I don't know that I agree with it. I think that I don't know if I agree with it, but at the time that's kind of, and I don't know if it's changed. I don't know if it's changed since then, but at that point in time, it was like even officer training school, they called knife and fork school, and so I was terrified. I remember being so terrified to go into that because you hear about boot camp and that kind of stuff. And it was like, it was knife and fork school. It's figuring out how to, the customs and courtesies, which is important, what your role is in the organization, that kind of thing. So even that standpoint, was really dumbed down or not dumbed down, but like gentle, the kinder, gentler thing, because they really needed, we really needed lawyers, we really needed dentists, and we really needed physicians. And so we threw them all together in officer training, taught them how to be officers, which they did a great job of, but they didn't beat us down from a morale standpoint.
So basically, your kind of training was probably tailored to your group then.
Right.
Yeah. Okay.
Well, all medical staff, I think.
Medical staff, exactly. Yeah, we're only medical staff in our group. Yeah, exactly.
Right.
That's correct.
So then you become. So if is the flight surgeon name a misnomer? Okay. So what does the flight surgeon do? Actually, because you're a physician and you're a qualified aviator.
Yeah.
So
So I
flight
determine
and
if you can
surgeon.
fly or not. Yeah. I
Okay.
determine if you can fly or not. Right. So my aircraft had, we've got our pilot, our navigator, our engineer, and then it's basically a 747, with a whole bunch of computers and a bunch of airmen in the back. Right. So
Like AWACS, right?
yeah, exactly. It's an AWACS. And so we do mostly surveillance in that aircraft. For a while, you have to fly a certain number of hours a month. And the reserve group at my base was Learjets. So I spent quite a bit of time in Learjets. It was really hard. I felt like
Cool.
Donald Trump. I know, right? Like I'd sit in the back and be like, wait, this counts for flight training? Like, and I get super
That's bougie.
motion sick. Yeah, I get super motion sick. So sitting in the back of an AWACS and no windows, it's like hot. Everyone's on their 55th monster, and I'm just like, oh my god, this feels like a frat house. And so anyway, so that was awful. But the Learjets were much more my style. So anyway, all that to say that stateside though, so I'm basically doing primary care. So I do sick call, I do some of their primary care stuff. My call sign was fingers. I might leave that there. So and then when we deploy,
You gotta explain it. You can't just
there.
fingers.
because at that point in time, in
All
order
signs
to
come from somewhere.
in order to qualify for your flight physical, everybody had to have an exam for testicular cancer. So that's where that came from. So everybody
there
thought
it
that
is.
was hysterical, right? So
Quick writing in a hurry. There's a good example.
yeah, exactly. Yeah. So I rolled with that. That was whatever. Yeah, so stateside, that's what you do. And then when you deploy with them. So you do the same thing when you go. I mean, I like to joke that, I stomped out chlamydia in the desert and got a medal for it, that kind of stuff, like it's,
But you did.
I did.
I
Yeah.
know this. Okay, so you have to share.
Yeah, yes. Well, it was, it was me and 300 guys. There was
for
Yeah,
for a sexually transmitted disease epidemic.
yeah, I'm telling
You
you what,
did.
yes, I got a commendation or some kind of, I don't even remember. I have the paper somewhere. It doesn't specifically say what it was for, but but basically you're still doing primary care over there, but there's 300 people and there's, only a few females. And so when you have an outbreak of a disease that might be carried by the females, and you just treat the females and then everybody's happy. So so that was, and then the other thing we did was even stateside. So I'm doing primary care, but these guys, you have the final say. And so after a year of internship, I have the final say about whether or not these guys can fly, right? So if I send them to a specialist, they go see the cardiologist. The cardiologist says, listen, you need to do this, this, and this. And they're like, no way, I'm not doing anything till I talk to Jess, not doing anything. And so these cardiologists and, the civilian cardiologists are like, who is this person? I'm like, oh yeah, it's me. I did a family practice internship. I have no residency. I'm not board certified in anything, but I will make the final decision. So,
That's funny.
yeah, but it's a pretty cool. I mean, it's an interesting position to be in. It's great because they trust you, right? Once you earn their trust, then you're just kind of one of the team there. So, but there are specific rules to whether or not you can get in a cockpit, and they're there for a reason. So, if they go to see a specialist and they put them on any medication, then it has to be an approved medication. And the civilian people don't know that, so they come back to me, and I determine, nope, you can't fly, or if your eardrum looks like it's going to burst, and we keep them grounded for a period of time, that kind of stuff. So
your job is to understand medicine and know the rule book backwards and forwards.
Yeah,
Yeah,
exactly.
Because
now
they're super big on SOPs.
Yes,
super big on it.
Mm-hmm.
So,
yes, very much so.
So what you said, it was the best time of your life. It was super fun. What kinds of stuff were you doing? Like what besides curing an entire regiment of chlamydia?
Yes, yeah. I mean, that sounds like service to the country if I've ever heard it. Let's see.
What's
I
the
was
medal
doing.
look like? It's a V.
Yeah, exactly.
Oh my gosh.
Oh
dude.
God, seriously.
Okay.
What was I doing? So like I spent a lot of time in the squadron. I really loved my commander. I felt like it was the best time of my life because I've never been treated with such respect as I have in the military. I mean, literally, I've been in the civilian world and I look around and I think I am not treated the same as I was, and it was just me and 300 dudes, right? And they were, once you earn that respect, it's like that camaraderie just is pretty remarkable. I was starting programs for them because I don't know, that's just who I am, I suppose. It's pathologic to some degree, but we were doing things like ask the doc. So that we would have they would have commander calls, and all the guys would be sitting in this auditorium, and then I'd get up there and I'd say, all right, what are your questions? And they'd ask questions, medical related questions, and there'd be some wildly
Goofballs.
inappropriate ones. Yeah, exactly. And I'd play along with that.
Is this
and,
normal size, Doc?
yeah, exactly. And yeah, exactly. And at that point, I probably didn't have quite the mouth that I do now, but I still had a little bit of a mouth. That's what my mom said. You never swore till you went in the military. I'm like, you're damn right. Yeah. It's a
Yeah,
survival
well,
skill.
Yeah,
Thank
right.
you.
Well, it's a new language.
It
It's a
is.
new
Yes,
one.
it is a new
It's
language.
It's
Yeah.
tactical language.
Yeah.
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 So that's what we were doing here. And then, those AWACS, they do surveillance in a lot of different places, with anti-drug cartel stuff in Ecuador. So we'd go down there for a month, and that was the only Aerovac I ever ended up doing, actually. And it was an Aerovac for a kid who broke his ankle, and I broke his ankle.
Oh,
So yeah, I know. I was like,
You
right.
created your own
Exigency.
I did. And
Yeah,
I was like,
experience.
yes, exactly. And
Exigent.
well, that was like bizarre. I was in the Ecuadorian hospital, and I was looking at this poor little airman, and I was like, oh my God, his mom needs to get him home. How do we get this kid home? We cannot let him have surgery here. It was awful. So,
Oh my goodness.
no, we were just playing, we had time off. We were playing soccer. And as I mentioned, I was a college soccer player and then played semi-pro after that before going to med school. So I was not going to let anyone beat me, right? Like, and this was part of, yeah. So this poor kid went in for a tackle. It was perfectly legal, and it was like the crack heard around the world. Everyone was like, "Oh!" And then I was like, "Oh my gosh, I did that! Now I got to figure out how to get him back to the States."
Now you have to
So,
fix it. Oh,
yeah,
man.
exactly. Now I got to fix it. So anyway, so that was my only experience.
Don't
with
tell
that,
Mom. I'll
but-
fix it. I'll fix it.
Exactly. That was pretty much what it is. Yeah. And I did not live that one down, which rightfully so. And then we would do
They didn't give you a
exercises
new
in other
flight
places.
name after that.
No, I should have asked for one though. It would have been
Right?
like way better than fingers. It'd probably been like the enforcer,
Breaker.
like that.
you know.
Yeah, exactly. Yeah. So, and I would have, so by payback time, I had already, deployed to, and these were deployments to Ecuador and these kind of places as well. And then, we spent a couple months in Germany and Canada and some of these other places just doing exercises and training exercises with other countries' militaries, which was pretty cool too. So I got to see the world. I had never really been out of the country before that. So, for me, it was a great experience. I would have stayed forever. I was planning to do it for life, but they really wanted me to stay as a flight surgeon. And unfortunately, you can't get a job in the real world without having done a residency. So I kept applying for residency, and they kept saying, no, we need you as a flight surgeon. And I was like, listen, I've already paid my time back. I've deployed. I'm going to get out and go back to residency. So I went back to residency and fellowship.
Oh, nice.
So you're in the Air Force and you're having the time of your life, and you are seeing the world. Well, first of all, where's the best place you got to go?
We deployed to Germany for a month, but they lifted the restriction of drinking.
Oh,
So
okay.
that was probably the best place, because
That's a good time.
Ecuador, we stayed at like a deserted Ecuadorian military base. It was nasty. It was gross. It was one step up from survival training kind of thing. And then the desert was sort of kind of that kind of stuff. We stayed in the middle of nowhere in Canada. And so the best time I had was Germany, because we stayed in this really nice place. We were there for a month, and they let you drink. I don't know.
It's funny because so many people who've been on the show, when we talk about where's your favorite place to deploy, where's your favorite place you've ever been, they're always like, oh, Germany.
Seriously. They treat us good there.
So you want to go. So what does a residency look like? Would you go to, like, okay, so I'm only naming, I think the only military hospital I can think of off the top of my head is Walter Reed, right? So, but that's Walter Reed is an Army hospital, yeah.
You can do an Army residency. So the Air Force has them. You apply for residency, and it's either within the military or they will defer you. If you get a deferment, then basically you go out and apply for civilian residency, and when you're done, you come back and pay back your time in the military.
And they wouldn't do that either. So now,
not at that time.
So you don't get a deferment, and how long do you have to wait to apply again and again? Like you said, every year is once a year you can apply.
Once a year you can apply, yeah.
And so was kind of the writing on. So I'll go back, Matt, Chuck. Matt, obviously, on the locker room, and I'll fill Jessica in. When he was in the Navy, he was assigned to LHD USS Boxer, LHD aircraft, helicopter aircraft carrier. and he was an airman, and they only had enough helicopters for one unit, and he was low man on the totem pole, so he was in like the 4th unit, right? So his job was, a janitor, basically, on the ship because he didn't have any aircraft command, and he hated it. And he asked them, "Can you? When are we going to get aircraft?" And they named the date. He's like, "Well, that's after I get out of the Navy, right? So can you assign me to another ship?" And they're like, "No, you're on this ship." So he's basically, not doing his job, and there's no hope in sight for him to get where he wants to get. Is that kind of analogous for you? Where did they even give you a timeline? Like, oh yeah, maybe in 2 or 3 years you can, or was it just was it amorphous and you never know?
So they have a point system, and the point system is not based on your test scores. It's not even based on your commendation medals or like your commander recommendation type stuff. It's mostly based on your time in service. So the people who have been there for 15 years as a flight surgeon, which sounds awful to me because you're, like I said, like that, I don't know, that doesn't sound very
Well,
good to me.
it sounds like
They
paperwork,
get more points.
mundane, yeah.
Right. Yeah, they get more points. And so then they get the top pick of the residencies from there.
That also has to be
So
hard though, going from that much time, like 10 years as a flight surgeon, having the ultimate say, and then going and doing a residency and then having to be at the bottom of the totem pole. Yeah, I'd rather get down there, kind of fast after, getting done with medical school and doing internships.
yeah, you're
That
still
way you
in
can
the
get it
shitty part. Yeah.
right.
And
So
well, and
you'll get
interestingly, so
comfortable.
I already did an internship. So then I had 3 years left so I did an anesthesia residency when I got out. But that anesthesia residency was wanting to hire people who had been flight surgeons because you're looking at it from a whole different world than if you just come out of medical school and you head into residency. Because I've made decisions, I know how to make decisions. I've been responsible for 300 people, and so there's just a different level of maturity and practice that you've
Right.
had by being in the military. So they were super stoked to have people coming out of the military into their residency, whether it was through a deferment or whether it was, me paying back my time and then going in. So, yeah.
So if you had gotten, so let's say you do get a residency at, let's go for deferment, right?
Uh-huh.
You get a deferment, you go back after your residency. So for those people that don't know, explain what a medical residency is. And I don't want to explain it in my cop way.
Yeah, okay, so 4 years of undergrad, 4 years of medical school, and then residency is anywhere from 3 to 7 or 8 years. And the residency is you're a physician, you're an MD or a DO, and that's where you're in the hospital and you're in the clinics and you're learning and you're actually seeing the patients, and is responsibility that's graduated. At that point in time, there was no work hour restrictions, and so we were working a lot. Now there are significant work hour restrictions that have gone into place, and so residents aren't there for 5 days straight, and they have to take certain breaks and that kind of stuff. But at that time, there were not, so we were working a lot, or there were some maybe, but not everyone followed them. So, but anyway, that's where you learn the trade, whatever the specialty is. So there's
that's
neurosurgery
the
residency, anesthesia
field training
residency.
program.
Yeah, that is exactly what it
SPO
is. Yep.
program.
Yep. That's the
Ours
practice. And that's
ours is 4 months and theirs is 4 years.
yeah. Yes. Yeah. It starts on July 1st every year. So we used to joke, don't go to a teaching hospital on July 1st. But there is, I hear that and I roll my eyes because I'm kind of like, there is a lot more oversight than I think people give it credit for. But that's the 4 years you have to work as much as you can and figure out how to be good at this job.
I'll tell you, I picked a physician specifically because they were a resident, because I wanted somebody fresh out of medical school with new ideas and a new approach, rather than somebody who's been, practicing medicine since I was a kid and they're still, talking about the old ways. And
Right.
I'd rather have somebody that's on the cutting edge. So I don't think it's a bad thing. But let's say you do that. So then if you go back after that, after the 4 years, what do you go back at? Can you go back? What do you do?
At that point, you'll go back as whatever you're board certified in. So, so my partners, for example, deferred for orthopedic residency, and then came back and practiced as orthopedic surgeons in the Navy, to pay back their time.
Okay.
Oh, so they could have left.
That's the other person we want to have on, by the way. Dylan's working on that too.
Oh,
That's
awesome.
one of them. Yeah, exactly. Yeah, that's one of them.
Yeah.
Yeah, I have 2 partners that were both Navy.
So if you deferred, were they already Navy prior to deferring, or were they Air Force and deferred and then went into the Navy?
Nope, you got to stay in the same track. So,
Right.
so my one
That's what I
partner went to the
figured.
military med school, and in the military med school, they assign you, here's what you're going to do. And so they said, oh, you're going to be Navy. So from that point on, he's Navy. He'll go through Navy residency fellowship if he wants to. His case, he deferred, and then came back in and paid back his time in the Navy.
Oh, okay.
feel
So
like-
that's fascinating. Military med school is a non-specific school. So it's not like there's an Air Force med school, or it's a generic med school, and then they decide where you go.
You have some say, I think, is if I remember right.
Like you get to put your
You have
top
some
3
say in it.
choices.
Yeah, you do. And very funny because there's only 3. Yeah.
Yeah.
Yes, but that's exactly how it is. And then they decide, as you come in, they tell you which branch you're going to be in because you've got to do all the training. With the military medical school, if you go there,
wow.
it's a 4-year program, but you owe 5 years back, is my understanding from that. Versus
You
if you're going to do my program, which is called the Health Profession Scholarship, if they paid for 4 years, I owe 4 years back.
Yep.
So a little
you
bit more.
1-to-1.
Correct. Yeah. Correct. And my one partner, who I hope comes on here, was an Annapolis grad, and then a military medical school grad, and then right. So he finished a whole career in the military before he could get out and come to the civilian world.
Because so
Yeah.
that's what kind of boggled my mind a little bit is when we were chatting. When we were first meeting, we were talking about, and you said that you had to get out of the Air Force after being in the Air Force and being a doctor and doing doctor stuff for 5 years, and then do a residency before you could go into practice.
Mm-hmm.
That must have been tough.
Yeah. And at that point, so I had my first kid when I was like on terminal leave from the military. So I started residency with a 4-week-old. Because I'm significantly older by that point. I'm 6 years older because I've been doing all this other stuff, kind of thing. So that was my first kid, and then I had the second one while I was a second-year resident, that kind of stuff. So, it was a rude awakening. I wouldn't trade it, like I've said, because I think that I was in a whole different place when I came out, as I've said, than I would have been if I just came right out of medical school from a maturity standpoint and that kind of stuff.
Were they harder on you doing your residency because they knew that you were already a flight surgeon doing all that stuff in the military, and they expected more out of you, or was it were they easier on you because you had that maturity coming in? How was
I
it?
think they may. I think they may have been a little easier on me. I think they sort of put me in a sort of a different category. It helped in this particular program because one of the guys that I went to flight school with was 2 years ahead of me in this, because he had deferred, right? So he got a deferment, and then he had to go back into the military. So, so that, I think that helped because they kind of knew what that looked like. But so that, yeah. And then after the anesthesia residency, then you do a fellowship, right? So, you don't have to do a fellowship. You want to practice general anesthesia, you can practice general anesthesia. My issue was that, I picked anesthesia rather haphazardly, for better or for worse. I got about 6 months into that, and I was like, wait, all these people are asleep and you can't even talk to them? I don't like this. And my husband was like, we are not quitting another residency. You are finishing this. I was like, oh man. So I finished the residency, and then, I did a pain rotation in it. And at that institution, we did predominantly cancer pain. And so then I was like, oh man, this is super meaningful. And I can talk to people and they talk back, which is wonderful because I don't have a tube in their throat. So that's how I ended up doing interventional pain from there. So then I did fellowship from there. There's a lot of different fellowships off anesthesia, off of every residency, but I picked pain.
So I think anesthesiology would appeal to a lot of people because the patients don't talk to you.
Mhm.
There's probably that
That's
level.
exactly it. Yeah,
But
that's exactly it. And so when I said it was an issue, all my colleagues were like, what the hell is wrong with you? Like, this is the beauty of it. You don't have to talk to these people. And I was like a radiologist, like,
anesthesiologists are like the hired guns. They're like the rock star. They're like they come in to like fight music, and people throw confetti, because your job is to bring this patient as close to death as you can for as long as you can and keep them alive.
correct.
Like it's like spinning plates the entire operation, right?
Yeah. And when shit hits the fan, you want that anesthesiologist in the room for sure.
Right. What is one thing that people don't know about anesthesiologists that, like, when they're going to get surgery, that is it's just eye-opening? So I've heard like funny things, I've heard scary things. What's like one thing that...
Boy, I think one thing that people don't realize about, because when things go well, it seems like a very easy job, right? So you're just kind of sitting there and you're waiting for the guy to be done. And the joke is that, they're sitting there trading their stocks or reading the internet all day long. And when things go very well, that's how it is. And that's wonderful. But when things don't go well, the the whole room turns to them, right? So if something's happening from a surgical standpoint, the entire room stops and turns to anesthesia to basically say, okay, here's what we're going to do. So the ability to work under pressure is probably like no other field of
Wow.
medicine.
Okay. So so that's key. I have a question about that then, because you are, like you said, it's again back to the pilot metaphor where pilots always talk about, and cops do too. I've always heard it's hours and hours and hours of boredom, punctuated by moments of ass puckering terror.
That's exactly it.
What I didn't realize is in a crisis, the anesthesiologist is kind of quarterbacking. Really?
Yeah, I mean, you're working with the surgeon because you're saying,
Sure.
You're peeking over the drug, like, what the hell's going on, right?
Yeah.
But you're managing the airway. You're managing all the fluids. You're managing the blood products. You're managing the whole thing. Now, if the surgeon just sits down, then of course you're in trouble. But from when a code occurs, then it's anesthesia that's managing that whole thing. Nobody can put a tube in like an anesthesiologist, that's for sure. A breathing tube, that is. Other tubes as well, but
yeah, I bet.
Yeah,
I can attest to Jessica's powers of time travel, because as a patient of hers, I was talking to her 1 minute and then all of a sudden it was the future.
Oh, I got a great question about anesthesia. Do some people, when they go under, do they get violent and then they wake up and they have no idea what happens? I woke up after an endoscopy and colonoscopy, and I thought, I was like, man, I must have done something to piss them off, because I had a puppy pad like over my face. Like I woke up, it was like all black. I was like, what the fuck is going on? Yeah. And I pull it off and I'm like, where the fuck am I? And I have this puppy pad on me and I feel dirty and nasty. And I'm like, I must have done something to him, because, and I've been put under, and there's been one time where I woke up getting injections in my back, and I was kind of angry. And then I was like, hey man, I'm really sorry. I kind of woke up angry. I don't know why. But does that happen, like where people will go under, be just fine, the next time they go under, they're angry, they're mean, they're violent?
Yeah, we have no idea why that happens, because it seems to have nothing to do with what we're giving people. It seems to just be kind of
Is it random? Oh,
Yeah.
it is. So,
I mean, there's some things you can do to try to prevent it. Like and there's different levels of anesthesia, right? So like if you have a tube in and you have general anesthesia, then there are ways that we can prevent that as you're emerging from anesthesia, or try to prevent that. It's a little bit different when we don't have a secured airway and we're doing kind of sedation or even like colonoscopy, EGD kind of anesthesia, where most of those patients don't actually have a tube in. It's a little bit different to try to prevent it, and everybody's a little bit different, and people will have responses to anesthesia and then the next time not have that. And so it's a little bit bizarre. The other interesting thing I would say about back to anesthesia is the redhead thing. Like the people talk about this. Yeah, this is a very real thing. And I always tell my patients,
I have 100%. I believe I have this.
Yeah, it's a genetic mutation. I'm married to a redhead, and my daughter's a redhead, and they need more anesthesia.
And you're I mean, if you're watching this on YouTube, you can see Jessica's got strawberry blonde, hair. Like her kids have beautiful, like that golden red, like they're 100% redheads. And
fortunately, I've never needed anesthesia, so I don't know if I require any more. But my husband has had a lot of anesthesia, and he definitely requires more, and even more like local, like lidocaine, just to numb up at the dentist, or all of those sort of things. Like my daughter will not go to the dentist without my husband, because she wants the advocate, like being like, she's gonna need more, more, that kind of thing.
Right. My brother-in-law is my dentist. And he will this is where I got it confirmed and why. So I read a thing that said, if you have a red beard, if you're a guy and you have dark hair, light colored eyes, and a red beard, you're one genetic marker away from actually being a redhead. It's some little factoid I read, and I was like, oh, that's me. I've got, before it was gray, it was red, my beard, and then dark hair, light eyes. So then I've always said, man, it takes more to get me drunk. It takes more. Like I go to the dentist and I tell them I can still feel it, and there's no way. I tell the doctors when they want to give me pain medicine, I'm like, that's not going to help, and they're like, you're lying. You're just trying to get, and I'm like, it's not. And so my brother-in-law, he did dental work on me, and he goes, man, you take more gas and more Novocaine than most people. He goes, and I said, I always joked about redheaded syndrome. He goes, oh no, you totally. I would be willing to bet, because it takes more. It's a real thing. Fascinating.
But I've also experienced the same thing, and I'm not a redhead. And it takes so much lidocaine, so much Novocaine. I've even had Naval Hospital dentist be like, I can't give you any more. You're gonna go into a heart attack. I don't
Toxic
want
dose. Yeah.
cardiac arrest. And I'm like, what the fuck?
Correct me if I'm wrong, Doc, but it's called redhead syndrome because it's common in redheads, but
Yeah, it's
it
not
doesn't
only
mean you
redheads.
have to be redheaded to have
Mhm.
it.
Wow.
Correct.
Yeah.
But
It's 'cause-
I will say I haven't met a redhead that in my sphere, like of what I do, that doesn't have it.
Yeah,
Right.
yeah. I mean, it's very like it's
Right, like it,
almost it's like
yeah.
redheads have it, and then
Well,
some
other people can have it too. Yeah, exactly.
I'll tell you this.
Crazy.
So this I didn't realize this until recently when I was because I grew up. I didn't have a lot of procedures. It's only in my 40s that I've had medical procedures that require me to go out.
Yeah,
I
you're old.
realized
Got it.
that I know. Shut up. I've realized that like when I get put out or in under like light sedation. So if I go to the dentist, like I said, he gives me gas. I'm out. You know, he has to turn down the gas sometimes because he goes, it's leaking out of your mask and getting us, the giggles. Like I have to turn it
We're all
down.
high. Yeah, neat.
No, it's hilarious.
And so, but I realized is when I came out from having a tooth pulled, I wasn't awake, but I was aware, and my like the processor in my at the back of my brain was still aware enough that I could tell him things that I was like, oh yeah, and this and this and this, and he was like, how do you like you should have been dead, and I can still hear and process things even under like heavy so it was just fascinating to me. The one time I could say is the propofol that the Michael Jackson stuff. That stuff will
Mhm.
take down an elephant. But
Mhm.
I've come up in the middle of a propofol drip,
oof.
like right in
Yeah.
the middle of the procedure, and they're like, "Oh shit, he's up," and I'm like, "What's going on, guys?" I'm like, "Oh, it's kinked," and they're like, "Shh." And I'm like, oh, back.
Ugh, yeah.
Hence why the anesthesiologist is important. So, Jess, I would be remiss because I want to get to something that you do as well on site. So you do interventional pain management, is right? That's
Mhm.
how. Okay, and I can attest both for myself and another person I'm very close to. Jessica is good at her job.
You.
But I wanted to talk to you about something else you have going because early on in this program, we did a whole series where we spoke to some Marines that had served in Afghanistan in the Sangin Valley, and gone through some serious shit. And one of the things they brought up and talked about, and one of the guys that was involved in that whole thing, after he got out, he went into business with a CBD company, and they were doing CBD infused gummies and CBD infused muscle balm and icy hot and stuff like that.
Mhm.
Now, you also have got your own CBD, correct? Is that
Yeah.
you? So then, before we get to, I want you to be able to tell people where they can get it. Let's get to the. Here's our chance to ask an actual friggin' doctor. What's the real deal with medical marijuana and CBD? Because I've said my piece
yeah.
as a cop and a narc, but
I think it's great.
you have a totally different insight from a medical standpoint. So the listeners of the show, there's a lot of people going through PTSD. There's a lot of people broken down from bad backs and bad knees and a lot of people with veteran injuries. What's the deal?
Okay. Okay. So when I was training, when I was a pain fellow, we would, we're prescribing opioid medication. We do urine drug screens. We're looking for drugs of abuse, right? That always included THC. And the reason was they said, well, it's a gateway drug, right? Um, and so we would test for that because the premise was, well, if they're going to use cannabis, then what's going to stop them? Because it's illegal, they're getting it illegally. Then what's going to stop them from, jumping right to heroin? Well, fast forward 20 years and we realized that
I remember that.
that's ridiculous. Yeah, exactly. Right. Like that's
Yeah.
ridiculous. How did we get here? I mean, how did we get here? I mean, that's a 6-hour conversation, thanks to Nixon and Reagan and all this other, anti-drug stuff. And how did we get here? But
Dow
the
chemicals.
basic premise, yeah. And so I started practice thinking, oh my gosh, people who use cannabis, this is so horrible. And then now look what's happened, right? Now we've recreationalized it in so many different states. I live in this little tiny part of Idaho, which is between two recreationally legal states. So
Right.
I knew nothing about cannabis, not a single thing. That was never in an exam, never in a board exam, never in a test, nothing. So, gosh, it must have been 3 or 4 years ago now. I said, I got to figure this out because my patients are asking me about it every single day. And all I'm saying is, it's bad because you might do heroin right away afterwards. So exactly. And so that pretty much stopped the conversation, right? So
You're like you're
yeah,
like quoting the dare officer from seventh
exactly.
grade,
That's
right?
what
Yeah.
I'm saying. Yes, exactly,
Yeah.
exactly. So
We were
then I went back
brainwashed,
and
man.
got
That was what dare was. It was
no,
fucking Nancy Reagan.
absolutely. Thank you. This is my point. This is my point. Oh man, I've read some pretty amazing
A
books
narc and a
on this
doctor
actually.
walked into a bar.
Yeah, oh my gosh, yeah, it's kind of crazy how we got to this point from the cannabis standpoint. But I knew nothing about it, so I went back and got a master's in cannabis medicine through Thomas Jefferson University. Took me longer than I wanted, a couple years, predominantly because I wanted to know, is there evidence behind this? And I was blown away by the evidence that there is behind it.
Okay, I want to go back to two things that we blew right past. First of all, the fact that you were called a pain fellow sounds like the most high-class torturer I've ever heard of. Like bring in the pain fellow. You know what I mean? Okay. I didn't want to
Okay, yep, all right.
I didn't want to breeze past that one because that's amazing that you got to
thank
be a
you.
pain fellow. Let's also not breeze past the fact that you just said you have a master's degree in cannabis medicine. That is not a speed bump. That is there's a thing. That's a thing.
That is a thing, right? I didn't know it was a thing either. I was like, what is this?
Wow.
How did you find out
but it
it
is a
was
thing.
a thing?
Oh, that is a great question.
Like a Google search? What, like did somebody
No.
We're
I had a
recruiting for the
colleague.
International Marijuana University.
Sign me up. Yeah.
She was
Exactly.
Googling
Very
pot one day and it
pains.
popped up.
Do I have to try something, or is this just plain books?
Fucking mascot
yeah.
is Snoop Dogg.
Yes, exactly. No, I learned about it because I was at a conference, a pain management conference, and there was a guy up there who's just started talking about how he had changed his practice to stop testing for THC. And I sat there thinking, what the heck? Like the DEA is going to come after you. This is horrible. And he lived in a recreational legal state. And he said, I just don't see the correlation, so I'm not going to test for it anymore. And that now, fast forward 10 years again, has become kind of, I don't know, maybe not the standard, but there more physicians than are not testing for it anymore because there's really no evidence that it leads to heroin, basically, right? So, and anyway, so he had talked about getting a certificate in medical cannabis, and I was like, a certificate? Sign me up! Like, I'm a type A overachiever. I want certificates. How do I get a certificate?
Card out of High Times magazine. Your certificate.
Exactly. Where can I hang this? Yeah. So I started in their certificate program, and they had the medical cannabis program, and it was just getting up and started, and they had a pilot crew go through. And by the time I was done with the certificate, I said, boy, I know quite a bit about this, but I would love to learn more. I would love to do the thesis, right? Like obviously I'm a nerd. Is right. So, cause nobody says I would love to do the thesis, right? Anyway, I hear myself, I get it. Yeah. So that's what happened. And it's been hugely valuable because again, what I felt like I was doing a disservice to my patients who were using this stuff, whether or not I was going to talk about it or not, they're using it. They don't know how to use it. The most knowledgeable human is the 25-year-old bud tender behind the counter when you go over to Washington, right? Like, what are we doing? And, there's so many issues here is that, the ratio of CBD to THC, the fact that you probably, the THC component is obviously the high component, but not the pain relieving component or the anxiety relieving component, right?
Sometimes it's the anxiety inducing component.
Correct. Exactly. Right, yeah. It depends on whose brownies you eat. Yeah, exactly. So those things, and the fact that I think it's pretty well known now that the percentage of THC in this stuff now is far different from the 60s. And so
and when your grandfather was smoking a joint, it was 15 to 35%. By the time Snoop Dogg was rapping about it and the album The Chronic came out, you're looking at 80-85%. Nowadays, you're talking 96-98% pure THC, and THC at high levels is a hallucinogen. So we're not sitting here saying it doesn't have correct. You have to be a little bit trepidatious.
Yeah, you do. And there are certain people that should not touch it, right? Like, I mean, it can induce psychosis in people who are susceptible. It is not for the developing brain, right? If you're under 30, I would say do not go anywhere near that stuff, right? But my most common patient to tell me that they're using cannabis is my 75-year-old grandmothers. Those are the ones coming in saying, well, my son said I should try this.
And they burned it.
Gave me this. Yeah, exactly. And so, so I kind of, I have the discussion, I have an Idaho license and a Washington license. And so I have the discussion with my Washington license hat. I say, listen, it's tricky because it is federally illegal, right? And it is illegal in my state. And so it is very tricky, but I felt like I was doing my patients a disservice by not knowing anything about it and just saying, I don't know, not my thing. So now
Right.
I can at least say, like, these are the things you really have to be careful of. And I preface it from a legal standpoint with, it is illegal in Idaho. If you go to Washington and get this stuff, you are a drug trafficker. My license, my DEA license is a federal license, right? I'm very,
Mhm.
very conscious about that. But the flip side of that is that there is benefit to CBD only without the THC component, which is,
Right.
after the Federal Farm Act is legal in all 50 states, there is benefit to that. You need a pretty good amount of CBD in order to induce the effect that we see from these studies for things like MS, neuropathic pain, arthritic pain. You need a pretty good amount. And so when patients come in and say, I have a 5 milligram CBD gummy, I'm like, oh yeah, that's pissing in the ocean, man. That's not gonna do anything.
What is
So
therapeutic then?
Wow. Yeah.
What are
so a
therapeutic
lot of
levels?
the neuropathic pain studies are upwards of 100 to 300 milligrams a day. Now,
Oh,
most patients
Wow.
I don't think need that. I mean, that those studies were on pretty significant symptomatology. So, and it, of course, it depends what you're using it for too. So if you're using it for a little bit of arthritis or back pain,
uh-huh.
that kind of stuff, you probably don't need 200 milligrams a day.
And is this broad
You,
spectrum or full spectrum?
full spectrum.
Yeah.
Yeah.
Because the broad
So,
spectrum is basically, it's not just like is it like more like a gimmick than anything?
so I don't. The longer I do my job, the more I think that the short answer to that is it probably doesn't do anything, but I have plenty of patients who come in and tell me that things help them, and I'm like, I don't. Okay, it's not
Placebo
hurting
effect
you,
Right.
too.
It's
right?
it could
Yeah,
be the
and
placebo effect. And if it
correct, or the
helps,
nocebo effect. Like
right.
we're actually giving you something, and
Right.
it is affecting you. So, in theory, it's certainly not going to be as effective, but I have plenty of patients who come in and swear by it. The other thing is topically. If you think about topically, and that's probably my number one seller. People love the CBD cream, and they get significant relief from it. That's not absorbed into the system significantly. It's really just
Mhm.
acting locally on kind of the skin tissues and the muscles. But remember, CBD is a very potent anti-inflammatory,
Yes.
very potent, and so that's probably the relief that people are getting from the topical standpoint.
Oh, okay.
So
Yeah.
the reality is that it's legitimate. And it's because I it's funny you say what you say, because if you're in Washington, you're allowed to say one thing. If you're in Idaho, you're allowed to say another. But ultimately,
Yeah.
like I said, at the federal level, you're still capped at what the feds allow you to do
Hmm.
or say.
Hmm.
But I will say this. Um, I can tell you that my position on it has always been, and you can agree or disagree, whatever. When I was working narcotics, I really discovered that my belief was that and my wife has multiple sclerosis, all full disclosure. So we discussed this when I was a cop. Like, it was legal in California for people to use medical marijuana, but I was a police officer, and like, how does that work? And should we
Right.
not? And so I read some books, and I realized that fundamentally the biggest disservice to medical marijuana has been the marijuana community itself in some ways, because the
Hmm.
only real advocates for it have been Rastafarian,
Pothead.
white dudes with
Hmm.
dreadlocks who play hacky sack in coffee house parking lots and tell everybody that Thomas Jefferson grew it.
Right.
Like, we all know that you're not trying to cure glaucoma, bro. You're trying to get to the next
Right.
great bed show.
Right. Yeah.
But when you look at like something like look at the opium poppy, and when you score it and that juice comes out of that opium poppy, you can just ingest that, and you will get the analgesic narcotic effects. It wasn't until people said, okay, time out, time out, time out, we need to take this opium and study it and really unlock the secrets, so to speak, where now you have the ability to do those kinds of surgeries and anesthesia and develop anesthesia and develop pain medication, and I mean life-saving,
Right.
life-altering things, because you've harnessed the power of the opium poppy. Yes, it's created the opioid crisis in some ways, but that we could go on and on about the medical.
But the flower hasn't.
But right,
The
it
opioid
wasn't the
crisis
flower's
is
fault.
Right.
right.
It may have
Exactly.
been Big
Right.
Pharma's fault, but it wasn't the opium
Correct.
flower's fault. But what
Yeah.
was the difference? They studied and and came up with formulas for what does what will kill you, what will not kill you, what can you take, what can
Mhm.
you not take, right? And nobody I guess nobody's ever been allowed to do that or has been willing to step forward and try to do that with marijuana who has any sort of, or at least when we were growing up, nobody did it with any credibility. Now it seems like some of that, what you're saying, if you have a master's degree in cannabis medicine, people are finally starting to say, okay, look, if we're going to be serious about this, then we need to have serious people having serious discussions about it.
Right, but it's a Schedule I drug. I mean, the federal government has said there's no, even cocaine is not a Schedule I drug, right?
Yeah.
So there will be no studies on this until they.
Methamphetamine is not a Schedule I drug, you guys.
Yeah.
Like
it's the prohibition
PCP,
there. Like it's prohibition all over.
Marijuana and PCP are in the same category, which is bananas to me. However, we can talk about what current administrations could or could not do with those laws at some point in the next 4 years. I don't know, but
until it's descheduled, no one's going to study it.
Descheduled, nobody's think legitimately.
I would love to. Correct. Yeah, you can do cross-sectional things. I've done surveys on patients, that kind of thing. I have a pretty big research arm of my practice where we have quite a few randomized controlled trials going, and I would love to be involved in looking at cannabis for multiple different things. But again, that will never happen until it's not a Schedule I drug, unfortunately. So, and now, the cart is before the horse because we've recreationally legalized it in all these different places, and people are growing crazy stuff, and it's super unfortunate because it's not regulated, right? And so,
right,
yeah. So
you're left to go to these places that this is kind of the idea of brothels versus street hookers, right? Brothels, they run clean operations, they have quality control. Street hookers, you get what you get, right? And so when you go to these places, and you go buy recreational marijuana, what pesticides are they using? What chemicals are they using? What's their manufacturing process? What's their contamination like? You don't know any of that stuff. There's no standards, right? And I get it.
Well, now we're talking
about should we have big pharma involved in medical marijuana? But I felt like what it sounds like is you have to basically say, look, I'm gonna be smart enough and educated enough on the subject to provide you with the information. What you do with it is entirely up to you as an individual, but I'm gonna make sure that you're fully aware of the law and of the research.
Mm-hmm. And that's what I say. If I'm prescribing you opioids, then you will not use cannabis. End of story. DEA, federal. That's the story. But the flip side of this is I also. Last I checked, we live in a country with freedom of speech. So I'm also able to at least express the things that I know, because again, I feel like if the patient is asking me questions, and again, the only person that is knowledgeable is the 25-year-old bud tender behind the counter, right? So I want to at least arm them with some questions to ask or some things to look for. I feel pretty strongly about the ratio of CBD to THC, and you'll go into one place and go across the street to the other place and get a totally different answer from people. And so that's part of the challenge. And I don't think that's going to get better anytime soon, unfortunately, but
I honestly think they need to deschedule it. I've talked to so many doctors, Curlin and Job, and I asked them, I just picked their brain on it. I'm like, what's your stance
Schedule
on this?
over the counter.
And they're basically like, there's a lot of really good things that, and properties of that plant that can be used medically. And he says, we can't use it. Kind of the same thing you're saying. We can't do anything with it. It's all locked up. It's locked down. It's federally illegal. I'm like, dude, this is crazy, because I've heard so many good benefits from other people in the medical community. People, that their grandma used to make a balm in Mexico, and they would have arthritis or you have a pain. They would put this salve on their skin, and the pain would go away, and they wouldn't be all messed up. But the primary ingredient in it is THC. And so there's a lot of good properties to it. And I just think that, me personally, that it's where the government's doing a disservice just because they want to enact control over.
Well, we can go back to 100 years ago and talk about the Marijuana Tax Stamp Act, and
I think it's ridiculous,
all that. But that's a different show.
But I think the same thing applies when we're talking about psychedelics and things like that. I think those are. I think in 15 years from now, we're going to look back and say, we were doing what for PTSD? We were doing what for all of these psychiatric conditions? You got to be kidding me, because I think that's what's going to, really help people quite significantly in the future. But it's the same story. It's that, there's not going to be a lot of studies on this because of because of the control that the federal government has over it right now. So,
Well, if people are going to do it anyway, then make it safe for them.
maybe, I mean, but look at Oregon.
There's some
I
of
don't know
that.
if that's the right answer.
There's some of that, right? But at the same time, you look at what happened to Oregon, they're quickly reversing it, right?
Mhm,
So
mhm,
there
yeah.
has to be a happy medium. There
Correct.
has to be some common sense, and I think it's important because, like you said, you have a master's degree in cannabis medicine. So now, when grown-ups start to have this conversation, and you open your mouth, hopefully, people will listen, rather because you're not the 25-year-old bud tender
Right.
with dreadlocks and a Bob Marley shirt who plays hacky sack on his lunch break. So
Right. Yeah. Right.
anyway, and you said you couldn't go the whole distance of an episode. By the way, you said I'm not that interested.
So, yeah, I think I said I didn't have enough to say, but
I beg to differ. Well, again, we're at the end, so I apologize for all the technical difficulties. At least I had to raw dog it. Like, I pulled all the cords out and just microphone and camera. That was it. Like, I could, yeah. So we'll have to try and put it all back together before locker room, because
Get a new USB stick or that new,
locker room locker room live from 4 weeks ago is being recorded tomorrow night. So how's that for time travel? Jess, Chuck, did we talk to Jessica about dedications? And I don't think we did.
I was gone all day.
We always offer up our guests a chance if they have somebody that they want to dedicate the episode to, who they served with, or fallen police officer, or firefighter, or member of this branch of the service that they lost. I wanted to give you the chance, but if you don't, we always have somebody available, and we can dedicate the episode to someone else. So we just wanted to offer it up to you if you have anybody.
I think I'll leave that up to you.
Okay.
I'd have to think about it for longer than 2 seconds,
Yeah, well, that's why I'd asked if Chuck had told you.
Shoot,
But
sorry.
Well, I have one on deck. So
we sprung it on you. Oops.
Perfect.
But again, Chuck came sliding in. You guys don't know. Chuck was like pitching his truck sideways, trying to get home. He was out and about all day. You had to go back and qualify today and make sure you could still carry a gun.
yeah, because I have surgery next week, and then I'm out of pocket. I'm not gonna be able to walk too well for very long for quite some time, and so yeah, once a year, because I've been out for a little bit, going through this medical pension thing. I have to.
Chuck's in the middle of
qualify once a
medically
year.
retiring, Dr.
Yeah,
Jess.
so
Whoa.
got that
His
done
knee
in
and his
LA.
back are completely messed up.
Yeah, and I had to get clearance from my doctors and my lawyers to be able to go and do this, because just to make sure that I cover my bases and I'm
Yeah.
safe. But I
Yeah.
was able to pull
Oof.
dedication, even though I did
Great.
come in sliding.
Perfect. He slid in late, but
So
go ahead.
this is a military veteran. So his name's Jason Roscoe. Officer Jason Roscoe was shot and killed while responding to a report of a subject brandishing a gun at a residence near the 4700 block of High Creek in North Las Vegas around 2:15 p.m. When Officer Roscoe attempted to make contact with the subject, the man ignored him and fled. After locating the man, the subject refused commands and fired at Officer Roscoe. Officer Roscoe returned fire, killing the subject. Officer Roscoe was transported to University Medical Center, where he succumbed to multiple gunshot wounds. Officer Roscoe was a United States Air Force veteran and had served with the North Las Vegas Police Department for 17 years. He survived by his 2 sons. He was 46 years old. His tour was 17 years, and he was a Air Force military veteran.
Well, rest easy, brother. We got it from here. And Dr. Jess, thank you for coming and spending an hour
Thank you.
shooting shit and dealing with the problems with my studio. Chuck, what do you got for us?
Well, I want to say thank you so much, Jessica, for coming on. It was a pleasure. I could pick your brain
Likewise.
all day on anesthesia and medical field stuff. Well, we only had an hour. So thank you again for coming on. Thank you for all today for tuning in. If you enjoyed today's episode, make sure to follow us on Instagram at war_stories_official and our Facebook at War Stories Podcast. If you're already following, we really appreciate it if you could share a post and help spread the word. You can also check out the link in our bio on both platforms to find all of our social media, our media links, and website. Our podcast is available on all major streaming platforms, including YouTube. If you'd like to support us, head over to our website at www.warstoriesofficial.com and grab some gear. Do you have a story to tell, or you know someone who does? We're always looking for law enforcement, veterans, correction officers, dispatchers, firefighters, medics, ER doctors, and ER nurses to feature on the show. If you're interested, email us at booking.warstories@gmail.com and I'll forward you to Dylan. Or you can message Dylan directly at linkedin.com War Stories Podcast and share your story. We'd love to have you on. If you know someone to be a great fit for us, please send them our way. Also, check us out on TikTok at www.tiktok.com War Stories Locker Room, and our
Still
producers
did go on
LinkedIn
TikTok.
at linkedin.com War Stories Podcast. Thanks for all the support. Stay safe.
I know we have to be on TikTok, just like I know we have to be on Facebook and Instagram and all that kind of stuff. That's a little bit of the FUD in me. I'm like, oh God. And I'm
Also,
supposed to
make
point down and go, hey, hit the button, like and subscribe. Blah, blah, blah.
Yeah. Make sure when you follow us on YouTube, like,
Yeah.
comment, subscribe, notification bell, bing bong, do all that stuff.
Yeah, let's hit that button. Wait. There you go.
Yeah.
All right. Well, yeah, Jess, thank you seriously, and I'll let
Thank
you go.
you.
'Cause I know you have somewhere to be. But
Thanks so
the rest of
much.
you guys, until our next episode, come home with your shield or on it. So once again, in a very rare War Stories moment, we are adding a tag to an episode, which we've done in the past for different things. But this time it's because our guest did not give out her contact information for a discount that she has for us. So you guys, you just listened to my actual back doctor and my wife's pain management doctor. Again, we said it was okay. Chuck's like, I don't know if I'm allowed to say this, and she's like, I don't know if I'm allowed to say it either.
You're talking about the CBD queen, right?
Yeah, the CBD, Jessica Jameson, Dr. Jameson,
flight surgeon, CBD queen.
And yeah, she has I mean, I was shocked just now because we're recording this right after we realized we didn't have her give out the information. I was so surprised that you can have a friggin' master's degree in CBD medicine, and I'm really impressed that it's reached that point in kind of the world of actual respectable medicine. I wish. I mean, I know this sounds weird as a narc, but I really wish the federal government would take it off Schedule 1, because the fact that it's in a Schedule 1 with like PCP and then methamphetamine and opium, methamphetamine and opium and heroin and stuff are in Schedule 2, but marijuana is worse than those. Like, go ahead, take it out of Schedule 1 and study it. That's what needs to happen.
Yeah, absolutely.
Anyway. But you know what she didn't talk about, and I asked her, I said, do you want to come back and do it on another episode? And then I said, or Chuck and I can talk, just record a quick tag. And she was in the middle of she's like, I'm headed into a procedure, and so she couldn't come back to do which is fine. But she will come back and talk about more Air Force stuff and more, doctor stuff later. But she has a CBD company, dude.
Oh, yeah, she does. And that's on the screen right now. And if you want to get anything there, you can go to www.
Oh my God, you sound like a commercial.
.com. I do.
You sound like a total but wait, there's more. You you slipped into like full-blown commercial mode. Well, that's right, listeners. You too. It's like so ingrained in you to freaking do an ad read. Anyway, 100%. What's the website?
Go to www.corecbd.com.
Don't do an ad read. Just give out the website.
That is COEURCBD.com. And you can also go to the same at Core CBD on Instagram and Facebook. Use code War Story to get 15% off. Again, that is at Core CBD on Instagram and Facebook.
She gave my wife the sleep, and so it's mixed berry for sleep, and it's 10 milligram CBD gummies with melatonin. I tell you what, CBD or not, I could never ever take these for myself. My wife takes melatonin, my son takes melatonin. I in fact cannot take melatonin. It turns my dreams. No, my dreams get real friggin' weird, dude. Ooh. And I'm not the only one. I've talked to other people. They're like, when I take melatonin, it makes my dreams weird. So I don't know what that is, but it happens to some of us. Wow. And then this other one, 25 milligram watermelon gummies. So we thought we would make sure we promoted Dr. Jameson's CBD business. Absolutely. I even looked up the website here, so you can, those of you that are listening, you won't be able to see this. Ooh, but just go on YouTube. In fact, this is a good chance for you to go on our YouTube channel and like and subscribe and leave a comment, and what's that? We have to have all the hit that button.
That notification bell.
Yeah. Just, you want to hear that? I'm terrible at that shit when it comes to stuff. Anyway,
all right.
here's the website. So check this out. Like, she has her story. It's obviously veteran owned, recommended by clinical expertise, right? All this stuff, right?
Yeah.
I was impressed too. I went on her website, and I totally sound like, I'm not trying to sound like a commercial, but what other website but a military, like military person and doctor, right? Military person and doctor. You go onto the lab reports, like she has literally posted links to the lab reports, and you can download the PDF. So
That's
she's
really good.
like a lot of people, they just put it out there and tell you, and she's like, no, I'm gonna provide you with documentation, because people that I want to use my products are going to be the kind of people that want to know this isn't a bunch of BS. So yeah, she sent us samples, or she sent my wife samples when my wife started visiting her as a physician. And she also wanted to come on the show. So there's your discount code, guys. You can get 15% off. Just
make sure to type in War Stories for 50.
Yeah, War Stories, and
off.
it's all lowercase and all one word, no space. So it's War Stories, one word, lowercase.
Just as you see it on the screen if you're watching, which you should be watching.
Right. And we already did the outro. So bye.